Good afternoon, everybody. I'm Dr. Jennifer Mines, speaking today as the Multnomah County Health Officer. I just have a few comments on the topic of being taken off the watch list. I'm going to hit on just three topics. One is what it means to be taken off the watch list, and just a reminder of what those metrics are. The second is touching on generally what's next for public health with respect to COVID. And then I'm going to get very prescriptive as we head into Labor Day weekend. I do have some messages for you to convey to the public on behalf of public health. So as everyone knows, Multnomah County has come off of the state's watch list. That means that our number of sporadic cases has dropped below 50 per 100,000. Sporadic is a term used generally to describe cases that are not linked to a known transmission chain. So these are cases that are not linked to a known outbreak. And even though our contact tracers are really set up to focus on interrupting transmission by getting a hold of contacts, and not always figuring out exactly where someone got infected, they do try to piece together some picture of community transmission locally. So this is good news. I think it's a result of cases coming down overall, as we've seen in the last few weeks. So I think we welcome this news, and it also, being on the watch list, gave us a chance to take a look at how we were doing in general, and how in particular we were working with the state. And so those efforts continue, even though we're now technically off the watch list. So to the second question of what's next, I think, again, this is good news, but we have a ways to go yet to meet the school metrics. Those are slightly different. They're based on just number of cases per 100,000. So for K through 3, we need to be below 30. And for K through 12, we need to be below 10, which is a very ambitious threshold. And I think is going to be a big lift for a county the size of Multnomah, given the level of community transmission that we're seeing. And even that we saw in some of the most cautious times when many people were obeying the governor's stay-at-home order. So I think we do see this as our next priority, given the benefits of school for kids in terms of their short-term and their long-term health. So again, this is good news, but we still have work to do. And so as we look to the more immediate future, this is my third message and probably the main one for anybody watching or listening. As we head into Labor Day weekend, I want to be really clear that we saw distinct upticks after both Memorial Day and July 4th holidays, following times that when presumably people were getting together. And we saw some very distinct upticks both in demand for testing, in cases, and in hospitalizations. I can share some specifics with you in just a moment that I'll bring up. But I do want to highlight that in light of Labor Day coming up and what many people view as kind of the last goodbye to summer, and a chance to visit with friends and family. Our ask of the public is to just find one way to take your plans down a notch in terms of risk. So that might be having a smaller group. It might be convening your group virtually instead of in person. Definitely means having people outside, and everybody committing to face coverings, even if you know each other well, and really maintaining that 6 feet of distance. And anything inside, we'd urge you to avoid being inside together, but anything inside, you should have windows open, fans blowing with good ventilation, face coverings, and chances for hand hygiene at every turn. So maybe I'll turn it over to Kim Toevs if she wants to add comments, and I will look for those exact numbers for you that I referenced around holiday weekends that we've seen earlier in the summer, because they are pretty telling in terms of disease patterns. Kim, do you want to make any additional comments?
Sure. I think that the prevention messages are really important that Dr. Vines shared with everyone, as well as our concern about the natural tendency to socialize around a long weekend and how it's so important to be careful about that. I may make a comment that the data itself, if you're tracking it, is a little bit hard to follow on occasion. We've got one set of phase 1 reopening metrics that we successfully passed. Then we've got a different set of metrics that put us on the watch list and that we're now coming off of. There's a third set of metrics that's used for school reopening, and there's one set of numbers for K through 3, and then one set for older. And then there's a set on top of that for phase 2 metrics. So I understand that it's really hard to navigate exactly what are the metrics for each of those, where are we at in terms of that, and what's the meaning of that in terms of reopening, business sector guidance, et cetera. I think we all feel that we understand that we were not able to progress from phase 1 to phase 2 while we were on the watch list. As we come off of the watch list, we are not quite meeting all the phase 2 metrics at this time. But all of us, frankly, have significant concern about meeting the school metrics as a real key area of focus for us, because we know that the long-term impacts for all sorts of kids on not being able to socialize and learn together in person are really significant. So we're all working really hard to support that. So that's the metric that we're focusing on right now in the immediate future. And we're glad that the good news has been there about the watch list metric. We will watch it very, very carefully over the next few weeks to see what happens as we have that Labor Day weekend come up.
Thanks. So let me just wrap up before we open with questions. I just want to share some analysis that our internal epidemiologists did. So in the 2 weeks following Memorial Day weekend, demand for testing went way up. So the number of COVID tests performed expanded by about 50%. The actual percent of cases, so the number of positive tests, increased by about 40%. And overall, there was a 240% increase in both the rate of COVID and in COVID hospitalizations. When we looked after July 4th holiday, similarly, test numbers increased by about 25%, and the percent of positive tests again increased by about 40%. And that time we saw about a 58% increase in the rate of COVID and a 20% increase in hospitalizations. So again, I've said before, as we get more time and more weeks of data, we're more easily able to discern patterns. And so there is clearly a pattern following these holiday weekends when people tend to get together. So again, if you could convey our message around Labor Day weekend, we are trying to get down to those school level metrics, which are going to be tough. And so we need everyone with us in terms of lowering their risk and really following precautions. I think with that, we'll go ahead and open it up to questions.
Reporters, you can just unmute yourself and go ahead and ask.
This is Rob Manning from OPB. What is the difference in terms of public health priorities, or how you would want the public to be behaving with regard to COVID-19 if you're trying to meet the school reopening metrics versus trying to meet the phase 2 reopening metrics? I mean, do those actually make a difference in terms of how you want the public to be behaving?
This is Kim. I could just speak to the metrics themselves. The school metrics are about the case rate overall. So it's not even really about the case rate among children. It's about how our whole community is doing around spread. So anything that we can do to decrease the case rate is going to help the school metrics. That's where we have the biggest gap between what we need to achieve that the governor has set for us and where we're at right now. Some of the metrics around the watch list are around how many of those cases can be connected to households or to outbreaks. That's one of the metrics that is also relevant to the phase 2 reopening. It's both a statement about how well our contact tracing team is doing, but it's also a statement about what kind of transmission is actually happening in the community. So if you have a number of cases where people have no idea who they may have been around that they were exposed to that had an illness, they don't know that it was a coworker at work in an outbreak setting or a household member who is sick, and we can't connect them to any other case, then that suggests that there are probably a higher level of community transmission going on, and probably, I'm going to say, what's having folks not know who they're connected to is that people have expanded their social circles, right? So they don't know if it was somebody that they have enough social contacts and social interaction. They're not sure which of those social interactions put them at risk. Or there are other settings or venues that they're in where they may have had close contact with people that they didn't know their name. So it's both about we've reopened and people are circulating and connecting enough that they can't name their contact, and we can't also help do that work diligently. And that would suggest that there's a level of general transmission going on that concerns us. It's the same story as you get when you get a high case rate. It's just another way of looking at it. The prevention behaviors we're looking for will impact all of the metrics that we need for school reopening as well as for some of that business sector reopening. The approaches are one and the same. So ultimately the approaches benefit both of those things being able to happen.
And there, Nick here, Tribune. Hi, everyone. Thanks for the opportunity. I'm wondering, as you look at the current numbers and the trends that you see there, how many weeks or months would you say we are away from reaching either the K through 3 metric or K through 12 metric, just looking at the numbers and how we're doing of late?
A few weeks ago, we had a case rate of about 70 per 100,000. The K through 3 threshold is to get it below 30. The fourth and on through higher education is to get it below 10. So that gives you a sense of like 700% higher than where we need to be. Those rates have changed each week. We were down to 60 and then to 50 and now to 40. As much as we're getting close to 30, I do want to say, one, we're concerned about what will change with the Labor Day weekend coming up. And two, there's a fair bit of variability from week to week. So even if we do see a trend over 2 or 3 weeks of a decrease, I don't think that means that we're sure that the next 3 weeks would then see that trend continue substantively and we could get a jump start on opening schools. I know that the school districts are expecting that they will not open in the next few months for sure, August, September, October. And that is probably going to be the case. We're probably going to, even if we plateau, we're going to see some up and down. And it may be a bit of a challenge even for K through 3 to get below the 30. We certainly have a ways to go to get below 10.
Thank you.
Can I jump in as Ted Sickinger? And appreciate you guys making yourselves available. Is there a scenario where we do meet the phase 2 guidelines and the county decides not to go forward because it's more concerned about the school reopening? How are you guys going to handle that?
Thanks, Ted. This is Jennifer Vines. I can take a stab at that. I think as I look at the phase 2 reopening versus the school metrics, again, as Kim said, I mean, they both rely on the same goal of suppressing virus transmission as much as possible. I could imagine from my read of these metrics that we could be in a scenario of meeting phase 2 reopening metrics, but not meeting the school metrics. I can't speak for our chair, who would have the discretion around this. And there's also the fact that Multnomah is now essentially linked to Clackamas in Washington County. So it really would be a regional decision. But I think the scenario is possible. I think here in Multnomah County, I think we're really pushing for those school metrics more than anything, as opposed to phase 2 metrics, which could give us another bump in case transmission.
Thank you.
Brian Anslinger here with K2 News. Thank you for making yourselves available. Question I asked, I've heard a lot about the spikes that we've had over the holiday weekends or after the holiday weekends. We see the numbers go up. Is there an argument to be made that for a 3 or 4 day period next week, we should just shut everything down and tell people stay in your homes, don't go anywhere? And is that worth trying to convince leaders to make that decision? Thank you.
That is a very interesting question. I'll let Kim comment as well. I think what we grapple with in the big picture is that at the end of the day, we're asking people to change behaviors. And so whether we do that by closing down what we can, which is largely public places, to the extent that people might still gather in their homes or backyards, we're certainly not policing that level of social interaction. So I think our approach has been that, at the end of the day, we're looking for everybody to do their part, so to speak, in following the guidelines, following the risk reduction elements in order to both get the social interaction and outdoor time that they absolutely need for their mental health and other reasons, but also prevent or at least slow the transmission of this virus in our communities. Really interesting question. Kim, do you want to add anything?
Yeah, I'm in agreement with that. I think that the impacts to businesses, for example, to ask them to close without warning, some businesses like restaurants, for example, they buy produce, right? They have employees on the schedule. What does that mean to the impact to workers as well as to products and to income? We're in this for the long game. And so thinking about manipulating things in that way that may have a significant ripple effect so that we can meet a certain number for a short period of time probably isn't the right way to approach the long game with this disease, and certainly brings a lot of folks along on a logistical and emotional roller coaster. I think your comment there about requesting people be really thoughtful about themselves and look at their own voluntary behaviors that they can have. Dr. Vines started by asking folks to just think about what's one thing you could do in your plans over the next couple of weeks that would increase your safety by one notch for yourself and your guests, your family members and friends, and try to sustain that might be a more feasible goal.
This is Aaron Mesh with Willamette Week. So yesterday, Dr. Seidlinger at the Oregon Health Authority offered a very striking anecdote about a house party on the Oregon coast attended, I think, by 10 people, which led to 300 cases that have been traced to that single house rental on the coast. Are you familiar with that case? And are any of those cases Multnomah County cases?
Yes, familiar. That is not the only situation that sounds like that. We have had a number of cases of families and friends traveling together within the state or maybe to a neighboring state, socializing together, renting a cabin. That's certainly not the only one. Some of those situations that are very comparable to that definitely have occurred in our county.
Quick follow-up. There's a case in today's report of a 29-year-old Multnomah County resident who's dead and with no underlying conditions. Is there any additional information you can offer on that?
Yeah, no additional specifics about individual cases. Just in general, unfortunately, deaths among otherwise healthy young people is not unheard of. And having just within the past week spoken also of a 37-year-old who died of COVID-19, or who met the case definition of dying of COVID-19, unfortunately is a stark reminder that really no age group is completely immune to the more severe effects of this disease, even though the risk is most certainly among those over age 70 and up.
Thank you.
I had a follow-up question. Hi, Allison Rogers with KGW on travel and the holiday weekend. We're talking about people going to the coast and other places within the state. Is it still the case, like if your county is in phase 1, that travel is supposed to be essential travel only?
Great question. I would have to look at the letter of the law around phase 1. I think in general, the notion is staying close to home, staying within your household, or within a stable number of people that you interact closely with, as opposed to traveling long distances and sort of rekindling or reconnecting with people that you haven't seen in a while. Again, the more people do that, the more we potentially amplify virus spread locally and potentially statewide. Do you know, Kim,
yeah, I have to pull up the
phrasing in phase 1
order right now to look at the detail on that.
And I will just acknowledge, people traveling for mental health reasons, for needing to cope with the stress of living in a pandemic that is certainly not going to end anytime soon. But again, there are ways to lower your risk as you go about the choices that you make. And so that's what we're really emphasizing is please just pick one way to lower your risk and that of those around you.
Thank you.
I don't think it's as much the travel in terms of being on a beach with other people or, moving through air travel, et cetera. Right now that what we've seen is people that are in multiple different households that normally don't live together, but are extended family or close friends, end up staying together in close proximity in one rented space together, end up carpooling together as they travel together. And so spending hours together in close proximity when normally you wouldn't have 3 or 4 or 5 larger families together in a group. That's the thing that's caused the transmission. It has, it tends to be that those families are doing that together, or those social groups, let's say if it's younger adults, are doing that together as they travel to the beach or to the mountains or wherever, but there's nothing really about travel itself. Sometimes people are meeting with folks in a different county, in a different state, and then we have seen some transmission from a higher prevalence area to a lower prevalence area. Most of the examples that we've had, though, I like the example that was brought up earlier. It's folks who are more local to each other anyway. It's not that they've connected across state lines. It's just that the act of travel has been to get away and to go socialize together. And then they're all in much more close proximity, indoors together or in a car together than they would have been otherwise. So those are some of the concerns.
I have a question. Thanks so much for being available to us. This is Julia Silverman from Portland Monthly. I just saw somewhere, maybe on Twitter, a note about playgrounds and basketball courts and things still being closed. And maybe it was from Portland Public Schools, like, please don't use our facilities. And yet we know so much more now that COVID-19 is so much more difficult to contract when you're outside. I know you can really only speak to the county, but I wonder if there's any guidance about outdoor facilities like that and whether people should feel safe using them.
Thanks. I'll take a stab at this one. Thanks, Julia. I recall that decision to close playgrounds, even though we do know now that outdoor transmission is less likely. I think the concern there is the high touch surfaces between children, and an inability to sanitize in between regularly on a schedule that would keep the risk to children as low as possible. We now know, of course, that kids are less likely, or appear less likely to get not necessarily to get the virus, but to suffer severe complications from the virus. So I think we could potentially rethink that. But overall, it was this notion of shared touch surfaces, and children interacting in close proximity, and just it was intended as a way to distance young children and to keep them from sharing those surfaces.
Following up on Julia's question, if I could, Nick here from the Tribune again. The whole point about outdoor transmission makes me wonder whatever happened with, there were all those questions early on about transmission during protests. And it seems like early on there was really no evidence of that, or very scant evidence of that. Did any ever develop, or did that end up not being a valid concern? And if so, what does that tell us about how the disease transmits?
We have not seen a significant number of cases where people said that they had been at protests in the days that they had been symptomatic, or the couple days preceding that, which also include when someone's really infectious. For folks who don't have any symptoms, you ask them about the days up until a couple days before they got tested. Same thing, that has not been something that's been significant. If it had emerged as a significant concern or worry where a number of folks seemed to be clustered, whether it was at protests or getting to protests together, I think that's information that we would have shared publicly, and we've watched for that carefully and have not seen it. Some of those protests, there is a really high level of folks wearing face coverings and masks, even though people are often closer than 6 feet together, proximally with each other.
So when you say not significant, does that mean less than 5, less than 10, less than 20?
Yeah, fewer than 10, you could say.
Great, thanks.
Hi, Allison with KGW again. More on outdoor transmission. Since we've been hearing this about the protest all along, do you know if there's been any discussion, either on the county or state level, to take outdoors into account when we're talking about what's in phase 2 and 3, stuff like outdoor concert venues, things like that? Is there any chance that those type of activities might move into an earlier phase than they are right now because we know more about outdoor transmission?
I am not aware of conversations to specifically take into account outdoors. At this point, when we identify contacts who are exposed, that is regardless of whether they were indoors or outdoors. It's even regardless of whether they're wearing a face covering, because really nothing is foolproof. So at least none of the conversations I've been in have taken into account outdoors. That said, it clearly lowers the risk. And so you've heard us really pushing on it this summer while we can to convene outside as much as possible. It does lead to the question of our level of concern heading into the cooler months and winter and what we call respiratory season, which is when we see influenza and now potentially COVID. So I think we do worry about what is going to happen coming into the colder months when people are going to be more likely to be interacting inside as opposed to outside.
Hi, can I jump in again? It's Ted Sickinger, and I'm sorry if this sounds repetitive, but and maybe Julie, you have some additional information on this, but I just want to make sure there's no impetus at this point for the county to move forward with applying for phase 2. You need either conversations with the other chairs in the other county, or you know, I hear you saying we're prioritizing the schools, but I just want to make sure that, again, coming off the watch list doesn't have any kind of immediate implications in terms of where the county is going and its reopening strategy.
Correct. There, to my knowledge, our chair has no immediate plans to look towards phase 2 reopening. I don't know what her conversations have been with Clackamas and Washington, but at this point, Multnomah County remains essentially in a holding pattern in phase 1.
Thank you.
We can take about one more question.
Brian Anslinger here with K2 again. This week the administration announced that it was going to purchase 150 million of the rapid COVID tests from Abbott Labs. Just wondering if the county is that something where do you all apply to the federal government to receive those? Have you made any initial contacts with Abbott to purchase some for the county? And then a second question on just where we stand as far as getting prepared to receive and deliver vaccines once they become available. Thank you.
I can speak to that, and then Dr. Vines, add anything you have as well. We're paying attention to that and looking at that, hoping to see what comes through the state to us. Normally, for the vast majority of federal resources, they come to the state public health division, and then the state either uses federal guidance or determines their own guidance with local participation in terms of how they'll allocate that to urban and to rural areas in the state based on need. So we have yet to hear more about that. The state has been helping to support purchase of some of those rapid Abbott platforms that different healthcare centers and facilities can use. They're slow per test because they just happen one test at a time. You can't batch large samples. So if you're trying to test a large group of folks, that's not the right technology. But if you have folks in an inpatient setting or you need to do some employee screening, the state has been assisting with distribution of that through some rural and urban areas. In terms of the COVID vaccine, there's a lot of information that we still wait in terms of timeline, in terms of if any experimental vaccine would be released before full FDA-approved vaccine, in terms of if the vaccine distribution would be from the CDC to the states to the local public health divisions, or if it would be more utilizing the healthcare system and pharmaceutical and immunization pathways of our private health system more for distribution. For example, with flu vaccine, often we rely a lot on healthcare providers and on retail pharmacies for adult flu vaccine. So there may be different mechanisms of distribution. We don't know what that looks like yet. We have just brought back our retired immunization manager to help us do some COVID-19 vaccine planning. You'll be hearing more from us in the next few weeks about really heavily promoting flu vaccine once September starts and we're in the window for flu vaccine. It's super important for us to keep folks out of the hospitals with other respiratory illness in case we also do have a surge in COVID this fall. We want to make sure that we've got plenty of hospital capacity. And it'll be very confusing for folks if they don't know if they have flu or COVID and they're trying to sort out comparable respiratory symptoms. We'd rather have them be protected from flu to reduce their chance that they end up missing more school or more work for that. Then we also have a role, actually, frankly, in terms of helping children catch up on their regular childhood vaccines that kids may have missed, whether they're infants or toddlers, or even the preteen age kids have a vaccine schedule as well, since a lot of the outpatient settings were closed for routine healthcare. And so we're all, as a healthcare system, trying to stand that up and make sure that they get caught up as well. So there's a lot of different components of vaccine work that we're working on right now.